Just to be clear, what the big ugly bill does, it lowers taxes for everybody, but most of the benefits from those tax cuts come to people with a lot of money, people who don't need the tax cuts. And it runs up the deficit trillions of dollars because the government won't be getting that revenue anymore. And that means we go trillions of dollars further in debt for tax cut benefits that go mainly to rich people. I don't need that tax cut. My fellow rich friends don't need that tax cut. And what's happening to offset some of the costs of that tax cut is that millions of people who need health coverage are going to lose their health coverage. Medicaid's going to cut millions of people from their rolls to save some money to offset these tax cuts. People are going to lose their food benefits. People are going to lose their health benefits, all to offset some of the costs of foregoing the tax money that rich Americans can afford to pay.
Yeah, Trump's bill that's about to pass the House is going to cut Medicaid, but I'm not on Medicaid, so why should I care? I would love to get on here and explain to you all the reasons why you should care about other people, low-income people losing their health insurance by Trump's Medicaid cuts. But you don't care. You don't care. I want you to care, but you don't care. What you care about is how Medicaid cuts would hurt you. So that's what I'm going to do. I'm going to explain to you how Medicaid being cut is going to be bad for you, a person who's not even on it. Okay? All right. Stay with me. I'm going to go real slow. When uninsured people go to the hospital and they can't pay, but they go to the emergency room anyway because they're about to die for some reason, and they can't pay, hospitals and providers eat those costs. It's called uncompensated care. Those losses that the hospitals just ate and the providers ate are oftentimes passed on to privately insured patients by way of higher prices and higher insurance premiums. That's you! You see how we got to you? Do you see how you're in it now? So by covering low-income individuals through Medicaid, the same Medicaid that Trump is trying to cut, it lessens those uncompensated costs, which keeps your premiums down. You see that? This is about you. We don't even have to have a bleeding heart. We don't have to care about everybody else out there. We can just care about ourselves and still fight against these Medicaid cuts. And this is not just my opinion. The Kaiser Family Foundation did an entire study that showed that Medicaid expanding Medicaid in states, lowers hospitals' uncompensated care by 25 to 40%, depending on the state, which eases the financial pressure on the entire healthcare system. That's you. You're in that too. Medicaid is also just preventative. It being in your state prevents things that happen that would exhaust your healthcare system that you would have to pay for. Lutheran Services of America is a very good example of that. The people who get Medicaid through them get all this preventative care, and they get care coordination and in-home support, and it improves the health of the people who are on it, and it reduces their need for high-cost healthcare services, right? And so then those members remain healthy, and they end up participating members of the economies around them. Like, it's just a good thing to have in your state economically. So look, the big, beautiful bill that wants to cut this, Trump's bill that wants to cut this, has already passed the Senate. We're in the final hours. We have like a day. You have to call your representatives. You have to tell them not to make these cuts to Medicaid, right? That people need them, that even if you're not on them, that they help your local economies as well. Find whoever your representatives are at the federal level. Find your representative, email them, call them, do whatever you can. You literally have a day. I did it earlier today to tell them, urge them to vote against something that's not just going to hurt the people around you. It would hurt you, whether you're on Medicaid or not. Okay? All right.
Breaking news, Republicans finally got to pass their big ugly bill. On July 3rd, as of 2:30 p.m. Eastern Standard Time, Republicans passed their big ugly bill, and here's how it affects you. $130 billion will be cut from Medicaid and Medicare, and billions of dollars will be cut from the SNAP food program. 11 to 12 million people will lose their health insurance by the year 2034. Planned Parenthood will lose $700 million in federal funding this year. This bill also makes the 2017 Trump tax cuts permanent. It includes $4.5 trillion in tax cuts for the rich and the wealthy. $50 billion will go to border security. This includes border agents. This includes ICE. This includes constructing that wall. And it includes detention centers like Alligator Alcatraz. This bill will make ICE the largest law enforcement agency in the country. Energy taxes will be rolled back, and child care credits will drop from $2,000 to $1,000. This bill also raises the debt ceiling by $5 trillion. Who benefits the most? Wealthy Americans, billionaires, rich folks. Who's at a loss and a detriment? You and me, regular folk, low-income people, poor people, the most marginalized, the least of these among us. Y'all better pray.
If you're a Republican, I want to know this answer. I want to know why. Why you haven't asked. If almost 12 million people on Medicaid are going to lose their insurance, why haven't you asked the one basic important question you should ask? If nearly 12 million people are going to lose their insurance, how many are going to die because they don't have insurance? How many? 3,000, 5,000, 10,000, 25,000. How come none of you're voting for this bill? You're voting, and some of you are cheering this bill on. You're not voting for it. You're a Republican. You're going, yeah, go, 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 go. Not one of you has asked, wait a minute, if we kick nearly 12 million people off of their insurance, how many people will die? And that's why I look at some of you and just with disgust, because you are so proud to be pushing this bill or voting for a bill that is literally going to kill Americans, and you haven't addressed it one time. That's just beyond sad.
So let me get this straight. You're a Republican senator standing proudly on the Senate floor, voting to rip Medicaid, Medicare, and SNAP away from Americans, and nobody thought to ask, hey, how many people gonna die from this? Not a single one of y'all paused, blinked twice, or did a math check? Just rah, 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 let's strip 12 million people of health care. Clap it up, America. We're officially in the Hunger Games, Congressional Edition. We thank all the originators and stitches of this video. Let's dive into the rest of the video.
Okay, so I just got off a call with 3 economists who are very, very high level. It was off the record. I can't say who it was, but these are people who know more than probably anybody how Republicans' death bill is going to actually affect Americans. And I took a bunch of notes in my car with like some junk mail that I had. Oh my God, you guys, I'm just going to read you the highlights of my notes because shit, it's bad. And some of these things are going to be answers to questions that you guys have asked me, so watch till the end if you can. So the SNAP cuts, first of all, biggest SNAP cuts in the history of the country by far, right? They're going to up work requirements. And normally, if there are no jobs in an area, they waive work requirements. But one of the things this bill does is say that you can't have that waiver unless unemployment is at 10%. That is unbelievably high for unemployment. So if you've just got like 9% or 8% unemployment, which is still shockingly high, you have to work or you lose your SNAP benefits. Stuff like that. There used to be an exception for single parents taking care of kids, but now if your kid is 14 or older, that exception no longer applies. Oh, and one of the ways they determine your eligibility for SNAP is whether or not you have internet. So if you're paying for internet, they consider that a luxury under this bill. It makes it less likely that you will qualify for SNAP. Okay, so the SNAP cuts are really dramatically large, but they were like the Medicaid cuts are so large, we don't know how to describe how large and what damage these cuts will do to this program. They were like, we've never seen anything like it by a long, long shot. They said the sort of consequences for our healthcare system are going to be so far reaching, way beyond just the people on Medicaid. It's going to hurt you, me, everybody in the healthcare system. And again, they talked about how work requirements are not designed to make people work because most people on Medicaid already work. They are designed to make you fall off of the program because you can't keep up with the paperwork and the red tape, especially if you don't have internet, which if you want Snap, you can't have. I mean, you guys, this is some sinister shit. Said by conservative estimates, 15,000 people will die from not having coverage every year, which makes sense since 17 million people are going to lose their health insurance coverage. And then there's this cost sharing thing. So now on Medicaid, if you are making over $20,000 a year, so if you're in this little area where you're poor but not like in the poorest, you have to cost share and pay about $1,000 a year of your own money for your health care. Rural hospitals, okay, so they gave $50 billion now for this Rural Hospital Stabilization Fund. So I asked a question, is that going to save rural hospitals? And the guy just looked at me and he said, it's like putting a Band-Aid on a bullet wound. They said this bill is going to drive up our cost of living almost across the board. Prices are going to go up across the board because of the bill. As far as jobs go, they said prior to this, the Biden administration passed the IRA and it was driving an American industrial renewal. They said for every $1 of government investment, private sector was putting in 6. This law undoes all of that. It's going to kill hundreds and hundreds of thousands, if not millions, of jobs. They said not only is this bill not pro-growth, but a recession is much more likely as a result of them passing it. The fact that the dollar is off to its worst start of the year in more than a century, that is related to the passage of this bill. The bond market being super shaky, that's all because of this bill. They said that the maternal death rate is going to go way up because they defunded Planned Parenthood and because of all the hospitals that are going to close. They said not only will people die, pregnant women will die more. A lot of you have been asking me what it means that Republicans are saying the tax cuts for rich people would be permanent. So I asked them about that and they said yes, because when they passed their tax cuts in 2017, those sunsetted after 8 years. That's why we're here again. This time they want them to last forever. So all of the tax cuts that benefit the wealthiest people and corporations are permanent, but the ones that help the working class are gone after 3 years. And I'll just close by telling you what one of the people said who had a lot of experience with healthcare policy and the economy. At the end of the call, she said, and I wrote it down so I could quote her directly, "It's grimmer than you can possibly imagine." That's what Republicans cheered when they passed it on the Senate floor this morning, and that's what House Republicans will cheer if they pass it too. But you know who's not cheering? Everybody in America who is going to suffer the consequences of this bill, even if they design it to kick in after the midterms. You need to know what they've just done to this country. Never, ever forget what they've done.
Okay, I just saw a post that was like, I don't really care what happens with this bill because I don't have Medicaid and these people voted for that and like whatever, they get what they deserve. Okay, this is why you should care. Because by law, emergency rooms have to treat people. They cannot turn people away. That is, by law, they have to give services. But if they can't get reimbursed for those services from Medicaid, they will just stop and they will close. So that means so many hospitals and rural hospitals specifically are just gonna close, which means you, with your private health insurance, will have to drive further to get health care. That is a problem.
I'm just gonna share with you real quick something I'm thinking about in this moment. I am a hospice and palliative care social worker. And I'm a death walker. And I've been doing a lot of speaking to clinicians, to the public, and to you all here about bringing humanity, God, I'm about to start crying, bringing humanity back to dying. And people needing to wake up to the reality of what dying looks like in this country right now. What I'm thinking about right now is how many people me and my team currently are taking care of who are laying in beds, dying, that are being paid for by Medicaid. The infrastructure that we currently have is already incapable of withstanding the gray tsunami. we were already in trouble. We were already facing a reality where people are going to die unnecessarily difficult deaths because we don't have the infrastructure to provide them with a better death. We don't have time to figure this out. The time was a long time ago. I think people really need to wake up. Soon.
My mom is 59 years old and she lives in a nursing home. She became disabled after having me, and she's been on Social Security disability benefits since 1992. These benefits pay for her 20 different medications that she takes several times a day. It pays for her nursing care. It pays for the living expenses that she has there. And in April, she got a letter from Social Security stating they had reason to believe that she was no longer disabled and could re-enter the workforce. She's been eligible for disability for 34 years, but now she's capable of working, a resident of a nursing home. Tell me again how these Medicare and Social Security cuts aren't going to affect us.
I ask unanimous consent to amend the rule to make an order the amendment at the desk that protects against any cuts to Medicaid and SNAP.
The gentlelady from North Carolina has not yielded for that purpose, and therefore the unanimous consent request cannot be entertained.
Let's call it what it is. This isn't fiscal responsibility. It's class warfare, disguised in red, white, and blue. These folks didn't bat an eye while handing out trillions in tax cuts to billionaires and corporations. But suddenly, it's time to tighten the belt when grandma needs insulin or a single mom needs formula for her baby. Medicare, cut. Medicaid, gutted. SNAP benefits, slashed like they're trimming fat off filet mignon, which, let's be honest, is something they eat while the people they just cut benefits from are choosing between ramen or rent. The sheer audacity of it. These same Republicans who scream pro-life from the rooftops are now pushing policies that will lead directly to preventable deaths. Because here's the truth no one wants to say on cable news. Healthcare is life or death. You rip it away and people will die. Full stop. But hey, as long as defense contractors get their funding, right? This didn't start yesterday. This is the Reaganomics playbook, the Bush-Cheney blueprint, Paul Ryan's wet dream. It's called Starve the Beast. They run up the deficit on purpose, give Wall Street their tax breaks, then pretend there's no money left for the social safety net. Then they come in like undertakers. Oh, sorry, we'd love to keep Medicare, but the budget's too tight. Too tight? Y'all found $880 billion to give to billionaires in 2017, but couldn't find $8 billion to keep seniors from dying in pain? Make it make sense. Let's ground this with real numbers, since they love to throw statistics when they want to justify cruelty. Cutting Medicaid affects almost 1 in 4 Americans. That's 80 million people. 12 million stand to lose access immediately. We're talking cancer screenings, maternal care, ER visits, basic prescriptions. Gone. Medicare? That's 65 million people, mostly seniors. Your Meemaw, your uncle with the bad back, your neighbor on dialysis. SNAP? That's 42 million Americans, many of whom are working full-time jobs and still can't make ends meet. This isn't welfare queens and lazy moochers. This is your Uber driver, your Instacart shopper, the woman ringing up your groceries, the man mowing your lawn. But sure, let's keep blaming entitlements, as if being able to eat and not die of diabetes is some kind of handout. Now, while we're dragging Republicans, let's be honest about the Democrats, too. Where are you? Why aren't more Democrats on every screen, every social feed, every radio show saying Republicans are cutting your health care, your mom's insulin, your kids' lunches? Where is the fire, the fury? Because silence is complicity. If Republicans are slashing social safety nets with a chainsaw, Democrats can't show up with a butter knife and a sad press release. This is a 5-alarm fire, and some of these Democrats still acting like it's a campfire sing-along. Let's talk about impact. This isn't abstract. You've got veterans with PTSD who rely on Medicaid for therapy. You've got seniors rationing blood pressure meds on Medicare. You've got single mothers skipping meals so their kids can eat, now losing that last $150 a month from SNAP that kept them barely afloat. This country has money, trillions of it. It's just a matter of who we choose to protect. And apparently, it ain't you. But you know what? Midterms are coming, primaries are coming, and the streets are talking. People are paying attention. You can only rob people so many times before they show up at the polls with receipts. If you're angry, good. Be angry, be loud. Call your representatives, even the ones who pretend they don't care. Post, share, support organizations fighting these cuts. Support your neighbors, and most importantly, vote. Every seat matters. To the Republicans clapping while people lose health care, just remember, sick people can still vote, hungry people can still organize, and when the people get fed up, even the most comfortable politician can get packed up. Because if they really cared about life, they'd be saving it, not slashing it. See you at our next video.